Hey everyone. So I am thrilled to welcome Dr. Agnes Binagwaho to the stage. And she and I have had the chance to speak a few times over the years, and it's for good reason. As Raj mentioned earlier, I cover tech and innovation for Devex. And when it comes to health tech and innovation on the African continent, Rwanda is really on the frontier, as we're talking about in this session. So Dr. Binagwaho, thank you so much for joining us.
My pleasure.
It's great to see you. And I've been really looking forward to this conversation because Dr. Agnes, as her friends and colleagues call her, does not hold back. She speaks her mind. And I think we need a lot more of that in these conversations. So I really appreciate it. For those who don't know Dr. Binagwaho, she was the co-founder of the University of Global Health Equity. And you can talk a little bit more about that model. Recently, Partners in Health announced that she will be retiring from that role, but knowing Dr. Agnes, retiring from the role as Vice Chancellor, which she served in since its founding. Knowing Dr. Agnes, that means there will only be more work. She's actually retiring from that Vice Chancellor role to do more work in global health advocacy and other things. Exactly. So we'll hear more about that. And she was also the Minister of Health in Rwanda from 2011 to 2016. And laid a lot of the foundation that has since been built upon to make Rwanda such a hub for health. So let me just start with this very basic question. Rwanda as an emerging global health hub, one of our tasks is to talk about what lessons other countries may learn. And I would initially say, well, Rwanda is unique. Yes, there are lessons to be learned, but Rwanda is unique. And you've actually pushed back when I say something like that. Why is that?
Absolutely, because when you say that Rwanda is unique, you just give justification for other countries to be lazy. We are not unique at all. We are among the poorest country on earth, among the 30 from the bottom. However, our life expectancy, the health of our people is good because of a systemic approach to include innovation based on science, on evidence, and to integrate that in systems, meaning also leaving no one out. I remember when I was a minister, when I see something new, it is how can we make sure it reached the most vulnerable? When you reach the most vulnerable, you reach everybody.
So I want to go back in time a little bit. You, of course, are a pediatrician first and foremost. And I know that being in the delivery room, bringing babies into the world is a big part of your motivation to do what you do when it comes to global health equity. So you also returned to Rwanda, your home country, in 1996. Can you talk about some of the moments in your path that have led you to be such a champion for global health equity, and tech is a way to do that, from your time as a pediatrician to returning to Rwanda in 1996? What are some of those moments that led you to personally fight for Rwanda to be the hub it's become?
Because when I came back in Rwanda, the what was available for kids where I was before in France was not available, and this is the biggest injustice. Just you die because of the place you are born. So bring those tools for healthcare, also for innovation, and we have, like many countries, lack of human resource, lack of resources, etc. But innovation really increase the capacity of health professionals to guarantee good health outcome. So that's why you will see so many Rwandan be expert in their field, read what is new, what can I bring, etc. Proactively bring what the world has discovered for better care, so that with the little we have, we can do the maximum.
So can you take us into your time as health minister, 2011 to 2016? What were some of the steps you took? I mean, you mentioned earlier that any country can do what Rwanda has done, and to say that that's not the case is really laziness, right?
Yeah.
If I'm summarizing correctly. So
I think about this country, by the way.
Fair criticism. So what are some of the steps you took that despite maybe fewer resources than you would like, despite challenges, you took steps to set Rwanda up for success in this way, and you want to see other countries doing the same. What are concrete examples?
An example is bring around the table all the people concerned. And we doesn't have to believe that the health sector is the health sector only. If you want a good message for health care to be delivered, bring the pastors, the religious, the Czech from all religion in the table with you, with the media, with the civil society, with the NGOs, so that at least they are educated about what you want to bring, and they can be the echo of the science. And by making everybody working together around one plan, you tell the pastor you want the people you are leading spiritually to be in good health. You love them, no, so they are your best ally. Same for all religions and etc. So bring all the force around the table for the program.
So when you're talking about bringing different sectors together, the faith sector being one sector, you've engaged the private sector in some really interesting ways in your various leadership roles in health. I'll just zoom in on one example, which I've covered closely over the years, Zipline. So Zipline, a company that many of you may know, started delivering blood products in Rwanda, has since expanded to many other products in other countries. But I'm guessing that bold decision to partner with Zipline, really to be their first health ministry partner, didn't come without pushback. So I think it would be an interesting example to talk about because it's part of what has led to this global health hub status.
So in Rwanda, there is something that we don't have pushback when we bring an idea. We have a pushback when the idea is stupid.
Okay.
That's different. So I remember Zipline because I was there, and we bring that a few days before we lost a woman just because the blood arrived 25 minutes too late. A young mother. So when the opportunity came, you just give that example and everybody say yes. But to have a Zipline working in a country like Rwanda that is big like Massachusetts, you need to have the Minister of Defense because it passed above military thing. You know what it is, huh? With your people who are stealing documents, explaining what is in there. You know all this. So we need the Minister of Defense there. You need the Minister of Foreign Affairs because the borders are not far, and you need to explain to the neighbors that it's for health, etc. You need the civil aviation. You need etc. etc. So you bring everybody around the table and you discuss what route can be taken, why we are doing that, and why we need to save people. So it was blood for mothers, and since Zipline, we lost no woman for hemorrhage. Can you imagine? Yeah. And this talk to everybody. So the minister in charge of transport and aviation will give you all his support for reaching such a result. So bring everybody around the table with a win-win agenda, and also do what you can, because you need to change the laws to have Zipline. You need also to change the law of insurance. Nobody have insure those things that's flying everywhere. So we need insurance to protect the population, etc. And the media to explain if you see something like that, don't be afraid because it doesn't go very high. You need also to reassure Kenya Airways, SN Brussels, not Delta, they are not coming in our, but you see what I mean. Huh? So bring everybody around the table and make the agenda everybody buying. And why we love innovation? First of all, innovation when they are working is it's joyful, you know. In place to do a little, you can do more, and explain that to all the people on the table. You have 100% support.
Now, you mentioned that there isn't pushback against an idea unless the idea is stupid.
Yeah.
But when it comes to tech and innovation, there are a lot of risks. And certainly people sometimes avoid adopting an innovation or taking a risk because they want to protect their population. And I wonder, how have you navigated those tensions, or how?
No, I have to tell you,
No?
in Rwanda, it's not like that, and I believe it's still not like that. If you have an idea and the idea is good and you don't have the support, it's the person who sabotage you that will have problem, not you. So that means those ideas, you share them and you tell, because when Zipline came, I have no clue, no idea. First of all, I understand only one thing. It cannot be something led by the Ministry of Health, because it's transport, it's things that flying. I don't know how it was working. So it was an issue of either the minister in charge of ICT or transport, So, and when you explain the add value of what you can, the potentiality, because it was just a potentiality. Everybody come and work with you. So I don't believe that I never face a pushback for innovation, and especially because you explain. You first of all know your subject, have evidence, and talk about give example that speak to everybody. When you do the presentation, just show a road that is totally broken and nobody can pass through there. And so you just tell the minister in charge of transport, I need your support, and we have this thing that's fly. Everybody can be around you. So participatory process, and also make people buying is something. And if somebody push back, you just go above or you go below and say, I would love to save you, but look at this one.
So since your time as Minister of Health, Rwanda has continued to really be this hub, attract a lot of investment, produce a lot of health tech and innovation. But you still saw a void, and that's part of why you helped to create the University of Global Health Equity. So can you talk us through, how does training this next generation of health professionals fit into this picture?
So this is for health science. We have, like many countries, too few doctors, but not only too few. We have to recognize that the way we educate health professionals, they are not fit for the job, because nurses, doctors, we ask them to manage a ward or a hospital, and a hospital is a little enterprise. They have no management skills. They didn't learn that. They have to do it. And I'm told that doctors are not good managers. So I'm told that, but that means you need to give those skills. So that's why we educate young people to be health professional with managerial skills and leadership. Leadership to implement what they have learned, but to know how to advocate for support. Like I told you, have everybody around the table. It accelerates the health outcome. So we teach them also how to advocate for the people, and above and below, to create the demand and the communities, and also for convincing their bosses that this is the right things to do. And and many other things that you are doing. It's also equity, and it's in the north of Rwanda, in the community. So that means we want them to go and work where half of the people live on Earth, but the most underserved place.
So we have just about a minute left, and I mentioned earlier that you will be retiring from this role as Vice Chancellor. That will only create more space in your schedule, knowing you, to do more global health advocacy. So when it comes to where this is headed, Rwanda as an emerging global health hub, and how other countries on the African continent can take steps to similarly attract investment and push global health technology and innovation, what are you going to be doing on this topic, and what do you want to see people in this room doing on the topic?
So I'm going to have more global health activities, and I have just been proposed to join the elders of Emerson Collective that are there to change the world. And so I say yes. And together, we are going to work to bring those, it's more than innovation. It's to bring a mentality of using the tools that help to produce more health. And also to bring a sense of accountability, because in my point of view, if you can save people and you don't, you should be accountable about that.
What better way to end? Dr. Binagwaho, thank you so much for your time.
Yes. So if you hear that I'm retiring from my role of Vice Chancellor of the university, but you will see me more everywhere.
To be continued. Thank you.